Hello, welcome to OET Medical writing videos. My name is Trevor Gordon and I am one of the two founders of OET Medical Online. What you can see in front of you is a snippet of our homepage. So if you want to visit our site, it is www.oetmedical.co.uk. What we're going to do is we're going to give you a series of videos for different aspects of the test. As you can see, this video is the start of a series of writing videos that show you, or effectively walk you through, how to write an effective OET letter that's going to get you a grade B or even a grade A. That's our purpose. So without further ado, let us continue. Okay, so we're going in to do writing lesson 1. So this will be the first lesson in a series of videos that will culminate in a finished letter. So in this first letter on writing for the exam, we're going to look at the template for the letter you will be writing. Firstly, there are 4 possible types of letters which you need to learn: referral, advising or informing, discharge, transfer. These will become more apparent as you're practicing. For any letter you write, the most important thing is planning. You need to understand the task notes and you need to be able to respond correctly. This is why at the beginning of the writing test you have 5 minutes allocated to just read the notes. Nothing else, just reading the notes, because you really have to make sure that you understand what the notes are about and what you need to look at, and how you need to organize it. So, questions. Here's a list of questions that you can follow. What do you need to know? Who am I writing to? No question mark there. I'll add that later. What is the purpose of the letter? What information do they need? What information do they not need? What is the patient's condition, current condition? What is the urgency? Are there any relevant social factors? What in the letter can be paraphrased and what can be summarized? So, we're going to use a sample letter to follow along with and use the information in it to create our letter template. We're going to ask the questions you need to ask and use the answers to decide what we need to include and what can be left out. We are also going to see what can be paraphrased and summarized. As a reminder, you have to write 180 to 200 words. This is only the body of the essay. Those 200 words do not include the salutation, the valediction, the date, beginning and the end. It's the body only of the letter. So we have some patient information. I've laid it out here as patient information, social history, family history, medical history, present medications, present symptoms. We won't go through all of these now. Safe to say it's a male who has a problem with, as we're going to see on the next page, TIA, transient ischemic attack. His BP, that's the diagnosis. His BP measurements have been included, and the plan is to refer this patient to a Dr. Sally Anderson for further treatment. So the first thing you will do when you look at the notes is look at the task. Before you look at the medical notes, you have to know what the task is. So this will be the first thing you will do. So on your paper you will see something similar to this. Using the information in the case notes, write a letter of referral for further treatment to the hypertension specialist, Dr. Sally Anderson, at the community hospital, outlining the details of the patient. Okay, so we know what we've got to do. So we go through the questions. Who we're writing to, we know, a hypertension specialist. We have her name. What is the purpose of the letter? It's a referral for treatment letter. What information do they need? Present condition, present medication, medical history, diagnosis. What do they not need? Social history, unless it's directly relevant to her current condition. Family history. What is the patient's current condition? Left-sided paralysis, dizziness, slurred speech, loss of coordination, double vision. Is it urgent? If it's not mentioned in the notes, then it's not urgent. If you don't see a words such as urgent or immediate, or something that a paraphrase of something that says that this needs to be done right away, okay? If it's not in the notes, then don't include it. Are there any relevant social factors? None that relate to a condition. What can be paraphrased? Present symptoms. We can paraphrase that. You don't have to reflect them word for word. We can just make it shorter, join things together. Medical history, we can reduce that. What can be summarized? Medication. If we look here, there's a lot of medication, so somehow we should find a way of summarizing that. This is where your medical skill will come in. I'm not a medical person. This is where your skill will come in. So, how do we lay out the letter? The letter is in a standard format, and here is the top of the letter. So we'll have the name of the addressee, the address of the addressee. This will actually be on the left. I've just put the indicators on the left and pointed to them, but that actual address here, the address here, will be actually here. So what I should have done is swap them round, but your address will be on the left. Then you will address the person. In this case, dear Dr. Anderson. If you know the person, you're familiar with it, this lady, or she's a colleague, you can include Sally. But if you don't know the person, my advice is just use Dr. Anderson. And then you have the body of the letter. The body of the letter is this section. The valediction, which is the end, yours sincerely, and your name. That's not included. So the body is everything between dear and this, sincerely. Okay, so this is the end of this lesson. In the next lesson, we're going to look at transferring the notes in the letter and expanding them into fully fledged sentences. So basically, we will be developing our letter. So this is a new channel that we've created on YouTube. So if you like this video and find it useful, and you would like more videos, please subscribe. If we have subscribers or enough subscribers, this tells us that you like the videos and you want to have more of them. We will only know this if you subscribe to either the videos or subscribe to the channel. If you subscribe to the channel, you will get notifications of when new videos come out, so you don't have to come looking for them. Our website again is www.oetmedical.co.uk. As you can see, it's a secure website now, because this is a requirement now of many websites. So we've actually had our website secured, so any payment, any data that goes across our website is encrypted. So this is a new thing which many websites will have to follow suit in the future. So stay tuned for our next video, which will be made shortly. And as I said, if you subscribed, you will receive a notification. So thank you for your time and see you in the next video.